And good morning to you all. We are going to have a good time here, a discussion that's captivating the country right now in the wake of what happened last weekend, those shootings across America. And welcome to this News 9 Facebook Live. And I never understand how I always turn the sound down, it doesn't work. So let me talk to you about our distinguished panel. We're going to be talking about mental health and the mental health, public health challenges of these gun situations. And so what I did is I brought a panel together. We're going to talk about this, answer some questions if you have questions about this. But let me begin. I called on my good friend, Dr. Larry Bookman, the president of the Oklahoma State Medical Association, a co-host, because we're talking about the public health impact of what's happening across the country. And Dr. Murali, Krishna needs no introduction. And of course, somebody who really doesn't need no introduction is former Chief Bill Citty, Oklahoma City Police Department. It's good to see you, sir. Hope you're enjoying retirement.
I am. Thanks for having me here.
So thank you for tuning in here. Be sure and send those questions in. I'm going to turn to my friend, Dr. Bookman. This Oklahoma State Medical Association, you're the president. Correct. You've seen stories where public officials, trade groups have told doctors, y'all need to stay out of this. Your thoughts about what's happening and why that we need to be discussing mental health, public health, and gun violence.
Thank you, Scott. Certainly what we want to talk about today is the public health aspects. As a physician, our job and the job of the Oklahoma State Medical Association is to improve the health of all Oklahomans. Mass shootings in Texas and Ohio this past weekend have put gun deaths and firearm laws back in the spotlight. Some statistics: to date, we have had 255 mass shootings and in the first 217 days. The last major shooting in Oklahoma was 1986, in which 14 people lost their lives in the Edmond post office. The state's death rate from guns used in both suicide and homicide has been rising, and a major loosening of the gun laws, what's called permitless carry, has now passed and goes into effect November 1st. Oklahoma has also been affected by domestic terrorism, and with the Murrah bombing in 1995, in which 168 innocent people lost their lives and 19 children under the age of 6. I have a personal reason for discussing this wave of anger and violence. I was a first responder to the Murrah building and the first physician in the building after the explosion. In the last decade, an average of 589 Oklahomans died each year from guns. By far, the largest share of those deaths were from suicide and handguns. An average of 405 Oklahomans dying from self-inflicted wounds from 2007 to 2016. During that time, the rate of suicide has increased by 50%. Today, I want to discuss this violent trend and what we can do to come together as one. Dr. Krishna, we've heard reports that mental health is the main problem leading to this violent trend. Do you feel this is an oversimplification, and what do you see as to the causes and cures for the mental health part of violence?
Thank you, Dr. Bookman. Mental health and mental illness is my expertise. I've spent the last 50 years helping people with mental illness. And there is a significant misconception about the whole topic of mental illness and gun violence. If you take the gun violence deaths in the United States, there were about 39,000 gun violence deaths, out of which 2 out of 3 were suicides. People kill themselves more often than they kill other people. That's number one. Number two, the mass killings that you heard about in El Paso and Dayton, they're less than 1% of all the gun violence deaths in the United States. Most of the gun violence is by people that kill themselves. And the next highest group is the people that kill others that are fairly close to them, that know them. So the mass killings that you saw create a lot of hysteria, a lot of concern, a lot of fear, a lot of sensationalism. But that's just the tip of the iceberg. We have a more larger problem than the mass killings. Mental illness does not cause violence for the most part. It's a very small problem. Less than 5% of the firearm deaths are caused by people that have mental illness, certifiable, detectable mental illness. More than 95% of the people that kill other people are not mentally ill. And so that's a very clear statistic that's available all over. And there are some solutions, as long as we sensationalize saying that, mentally ill are killing people, that'll stigmatize people with mental illness, which is 16.5% in this country, about 50 million people. And they already have problem with access to mental illness care, treatment, and they already have problems with homelessness and with very many other issues.
I want to remind folks that we're having a discussion about public health, mental illness, guns, that we're not talking about gun control here, the stuff that may be happening in Washington. We're talking about the public health emergency that people are talking about. And Chief, you know this issue very well from a law enforcement standpoint. Help us understand what we're hearing from Dr. Bookman, Dr. Krishna. Help us put this into perspective from your point of view.
Well, I totally agree with Dr. Krishna. I mean, there is a huge misconception about mental illness and crime itself. Obviously, mental illness is on the rise, and it is an issue. It's a bigger issue, and there are some relationships to some gun violence. But like Dr. Krishna said, it's mainly suicides. It's not actually homicides, and most of the mass killings are not committed by individuals that are suffering from mental illness. So I think that we talk about gun violence, and if you have to talk about gun violence, the mass shootings bring it to the forefront. So we start talking about it, but you have to realize that there's tens of thousands of homicides committed with firearms every year. And most of those individuals, like Dr. Krishna was saying, are not mentally ill. It's more, in many cases, like in the area of gang violence, it's a culture. And it's not mental illness. It's the access to firearms, it's the easy access to firearms, and it's part of a culture. It's something that you have, and many killings are opportunistic. They're not planned, and it's because the guns are available and they have them. So dealing with mental illness alone and trying to spend a lot of money on mental illness, I think is a good thing for a lot of other reasons, because it is on the rise. It's on the rise with our youth in our public schools, and teachers are having to deal with that, trying to learn and dealing with a lot of that. The cause of that, I don't think, is completely understood. There needs to be a lot more research in that regard as to why that's happening. But obviously there is some relationship, but it's more towards suicides, and those have been going up on a yearly basis. The suicide rate is going up.
Dr. Krishna, we've seen a lot of anger in this country among groups. Anti-Semitism has gone up, racial hatred has gone up. We hear a lot of people talk about video games and isolation, that these people a lot of the time, much of the time, are isolated individuals. Can you talk about what the causes are and what we can do about that?
Absolutely. You have correctly alluded the fact that there is isolationism. People feel more lonely, 3 times more lonely today than they were just 35, 40 years ago. Along with that is the rise of obesity, is the rise of a lot of screen time on the part of youth as well as young adults, and in general the population. The internet has given a subset of people that relate to each other and develop and foment the ideas of this separatism. We are one, we are a great nation with tolerance and patience and gratefulness, and sometimes that is being threatened by some of these isolationist groups. And there's also a sense of anger and alienation and resentment. If you look at some of these mass murderers, most of them have had some degree of alienation and anger and lack of solutions. Finding healthy options is not something that they are used to. And we have multiple causes for what's going on right now. There's not one cause. There are social causes, there are biological causes, there are educational causes, and there are economic causes for this problem that we're facing right now. So the solution is going to be multifactorial, that we need to come together.
Chief, we just passed permitless carry. That's going to allow anybody over 21 with no training, no license, and no background check. We've talked about the anger that this country is experiencing. How do you feel this law will affect gun violence and violence in general?
Well, I think, when they started talking about, the legislature started talking about it, I opposed it. And I primarily gave an example of, you have officers out in the field that confront a lot of people, a lot of individuals, gangbangers, people on the street. Right now, they're already passing off firearms from the person that has a felony conviction that can't have a firearm to the person that doesn't have a felony conviction. Well, you have to realize that in this state, you can't carry a firearm if you have a conviction. There's a lot of people that don't have convictions. We have a lot of criminal element that has not been caught yet, especially the young. And so, and a lot of them are involved in gangs. And so trying to approach these individuals and try to work these individuals on the street, they already know what the game is. And passing a firearm off to an individual that doesn't have a felony record and can carry that firearm legally, there's nothing an officer can do. Before, they could take the firearm away from that individual, but now they can't, because that individual is legal to have that firearm and carry that firearm without a permit. And you have to realize, criminal element, it's pretty easy to get a permit in this state, but the criminal element doesn't even go to that much trouble to get the firearm. So I think it provides a greater risk both to law enforcement and to the community, because individuals like that are part of the criminal element, can carry that. And my whole point is trying to keep firearms out of bad people's hands. Not that people shouldn't own firearms and have firearms and be able to carry them. It's about keeping firearms out of bad people's hands.
We want to take some of your questions. I want to say real quick, thanks Teresa Ann for watching, Tony for watching, Johanna for watching, Mike. A lot of folks tuning in right now, and we're talking about the public health response, or the emergency that's happening, because this issue is about to be really big in Congress. Big pressure. The president's made some statements. He may be willing to look at some things he hasn't been in the past, but doctors are at the forefront of this emergency. And anybody who saw the NRA situation where the doctors got into it, where they told the doctors to stay in their lane, you were one of the folks that got really annoyed by that. Dr. Krishna and Dr. Bookman, your thoughts about the folks who are on the front line in these emergency rooms, taking care of folks with gun violence. What is your response to docs need to stay out of this?
Well, I was angered by the response of the NRA to an article by emergency room physician in New York talking about her personal experience with the bloodshed, with going home, changing her clothes that were blood covered, and how that affected her. No physician in this state can take care of those type patients without losing some of themselves. Doctors are not against guns, and I want to emphasize that. Doctors are not against guns, but we are against gun violence. Many doctors own guns and served in the military. I own a gun. I have served in the military. I learned gun safety, and I had training on the use of a gun. Today, we only need to be 21. We need to come together to create reasonable laws, not to restrict a reasonable person's right to own a gun, but to try to be sure they should own a gun. The Constitution gives us the right to bear arms. Nobody's objecting to that. This would have to do with an armed militia, if you know your history. We were to have a small army with armed militia for any violence that needed to be addressed. Today, that doesn't exist. We have a large army. We have an armed militia called the National Guard and the Reserves. We need everyone, including our elected officials, to be willing to compromise for common sense and public health. This is multifaceted. We need to take steps. Dr. Krishna, do you have words you'd like to say?
I think your words of wisdom are very appropriate. We need to respect the Constitution, the right to bear arms. At the same time, as physicians, we have the duty to protect the health of the public, of each individual and our community, and our first responders. They're putting their lives on line every day, the doctors and the first responders. And we need to see how we can help them to help our population better. And if you look at these statistics, United States, 39,000 gun deaths per year. Great Britain, 120 gun deaths per year. Can you believe that?
Yeah.
And the number of guns in the United States, 120 per 100 people. Great Britain, about 5 per 100 people.
And there's no difference in mental health
no difference.
or the video games.
Absolutely. Culture, the language is the same, the culture is similar. And you can see quite a contrasting difference how two nations have dealt with this situation. So you have the right to bear arms, but you need to have sensible regulation so that individuals that do not have the judgment in a proper way to protect the public have their hands on them, especially these mass killing war machines.
Chief, from your perspective, is there's going to be the gun control aspect of the debate. There's now the public health side of this debate. What are you looking at, with all your experience, where's this conversation going?
Well, I've always said that eventually enough people are going to be killed and die that somebody's finally going to take, and our political leaders are going to finally take an interest. The public's going to get fed up, you know, and it's sad to say it's getting to this point. And mass shootings, again, like was discussed, is such a small part of gun violence. But what people don't realize, and we're talking about deaths. You put out the statistics on deaths. You can double that and triple that on shootings. People that have been shot and not killed, because medical response is so much better than it used to be. And so it is a health issue. And the doctors, the CDC, which should be allowed to do research and determine, they've done some wonderful research on really what communities are really doing better and lowering their gun violence based on the fact there's not as many guns because they have some more restrictive, you know, laws that require people to background checks and things like that. I think that's where it's going. It's going to, it has to go to background checks. It has to go to some things. I've advocated for restricting assault rifles. It's a huge risk, and there's really no reason for them out there. I've been pretty outspoken on that for years, and there's no reason for that. And it puts risk and it puts the public. You know, respond to an active shooter with a handgun is much safer for anybody, whether it's law enforcement or an individual in a mall who takes it into his own hands up against assault rifle. You're starting to see police become militarized because that's what they're up against. And I don't think that's what we really want to see.
Can I take a question? I mean, there are a lot of folks on our discussion this morning, not all of whom agree with Dr. Bookman with everything's being said. So Teresa Ann, here's your statement, and I'm going to read this. The government cannot be in charge of deciding who gets guns. This sets us up directly for the already overreaching government to take all our rights. Look at what they have already taken. A lot of people out there just simply not going to agree. Let me just work the panel this way. Chief,
Okay.
What Teresa Ann says, this if we start moving toward off the slippery slope, right? Background checks, next thing you know, they're taking guns. Your thoughts about some of these people who really fear what may be coming in terms of reform?
Well, there's a lot of things the government does and legislate that restrict people. You know, you have to wear your seatbelt. You have to get a license for your car. They restrict people from who drives a car, when they drive a car. There's a lot of things the government does. But the point is that it's not going to restrict good people from having firearms. It may make the process a little bit longer and more cumbersome, but it's not going to restrict good people from having firearms. And we're not going to get there at that point in this country, nor should we. But we do need to make it harder. I remember watching a series in Chicago with some gang members, and an old seasoned gang member, he put it very simple. He said, there's a lot of kids dying here, there's a lot of people dying here. Guns are too easily available to everybody. We need to make it harder for bad people to get those firearms. So background checks, things like that would obviously play into making it, I think, much safer and reducing the number of firearms that are in bad people's hands.
Dr. Krishna?
I think there has to be a healthy balance. The answer is not either this or that. The healthy balance of, just like for pollution we have a healthy balance. For water purity we have a healthy balance. For food and nutrition we have a healthy balance. For exercise we have a healthy balance. So even in the areas of guns and behavioral threat assessments, there has to be a healthy balance of what is healthy, what is good for the community. That's what the dialogue that's taking place right now. How can we protect the public? How can we protect the people from this unnecessary deaths and losses happening throughout the nation, creating panic and anxiety.
Dr. Bookman?
I think the Constitution guarantees us the right to own a firearm. That was meant to be a musket. The government of the people, for the people, by the people, should allow us to be confident that our government is not going to take away our rights, that we are not going to go to a government-controlled society. But we should have the right to restrict guns to people who should have them, who have the background that allows us to feel confident that guns will be in the right hands. And I don't think that anybody who doesn't have a problem in their background would restrict that right. I think guns are a part of our society, but automatic weapons, as the chief has said, aren't used for defense and aren't used for hunting.
Well, we're about out of time here. This is hopefully first in a lot of conversations about this issue, because we've seen the national media, everybody struggles to cover this issue. Everybody struggles. And it's real easy to politicize. It's easy to whip people into a frenzy about what the facts are. But I've noticed there was a lot of people looking at the public health aspect of this. So we're glad that you joined us on this Facebook Live. What I'd like to do is I'd like to start with Chief Citty. Any closing thoughts, Dr. Krishna and Dr. Bookman, before we get out of here?
I want to say, I think, it's sad to say that it gets to this point, but the discussion's good. I like to see the discussions now that are being had, and everybody can have that discussion without somebody wanting their head, but wanting a politician terminated or going on the attack. I dealt with that as police chief a lot, and I would talk about it and say some of the things I've said today, and next thing I would know, it was the mayor's fault, it was the city council's fault. I think we're getting beyond that. I hope that we can have this discussion and we can have differences of opinion, because mine varies, and it has, and it's changed over the years. But something has to be done. So we have to be able to protect our families, our kids. We have to feel free to go to places without worrying about these types of things happening.
Thank you, Chief. Dr. Krishna?
Out of crisis comes solutions. So what's happening right now around the country is very healthy for us to look into where we are. Is this the right thing that's happening? Can we do something different to protect our citizens and to make this nation a great nation, safe nation? And this discussion is very healthy. This dialogue is very healthy. And ultimately, some healthy solutions will emerge out of this discussion, and healthy policy changes will happen. So I'm very optimistic about it.
And the last comment, my friend, Oklahoma State Medical Association President Dr. Larry Bookman, you've carried weapons for the country. You've been a first responder in some really awful situations. Your thoughts to share with us as we close?
Well, last month, the U.S. Secret Service came out with a report, and they stated there's no single profile that can be used to predict who will engage in violence. And mental illness alone is not a risk factor. Left untreated, mental illness may play a role, as many other factors, including gun availability, play a role. We need to learn to have tolerance for each other and to be able to talk about our differences. We need to understand that we are not always right, and that many issues are complex and may have multifaceted answers. I think this is one of them.
I want to thank the panel of distinguished gentlemen for being here this morning. And it's interesting, I was looking at one of our comments from Roy Bentley. He says, how about working on reporting mental health in troubled kids and work on bullying? That's our next one. That ought to be our next topic, shouldn't it?
Very appropriate topic.
Very appropriate.
Chief Citty, Dr. Krishna, and Dr. Bookman, thank you very much for coming in today on this Facebook Live. Appreciate your contribution to this and look forward to seeing you again real soon.
Thank you.
Thank you for having us, Scott.
And thanks for being here. See this again at news9.com/yourvotecounts, and follow me on Twitter if you'd like, @Mitchell Talks. Have a great weekend.